Hi, this is Jacqui Phillips from Millennium magazine. We are here with world-renowned cosmetic dentist, Dr. Steve Fox. He has transformed the smiles of some of the most famous people all over the world. Thank you for being here, Dr. Fox. It's an honor to interview you.
It's my pleasure. Thanks for having me.
Have you always been inspired to be in the dental profession?
I followed in my father's footsteps. He was a respected member of the community, a great dentist, and I thought that it was a great profession to get into.
So, what are some of the common things that we should know about with oral health? You hear so often that the way you treat your mouth, the way you treat your teeth affects your body. Can you explain that a little bit?
Yes, so the body's connected to the mouth,
Mm-hmm.
and it's called the oral systemic connection. And so it's very important to understand that there are diseases that are related to the mouth, and that we should clean up the bacteria in the mouth so we don't end up potentially with those diseases.
What are some of the diseases that you're referring to?
Well, if you have a very high count of bacteria and your gums are inflamed, you could lose bone, which is periodontal disease.
Mm-hmm.
You can make diabetes worse. You could have heart attacks, strokes, up to 6 kinds of cancer, and even dementia and osteoarthritis. So there are numerous studies to substantiate the oral systemic connection.
And that is why flossing is so important as well. You hear people that are like, you should floss every day, and so many people don't. And they say it leads to heart disease, so this is why.
Well, you should floss, and you should brush not only your teeth, but your gums.
Mm-hmm.
And you should see a dentist every few months so you maintain good oral health.
I have a question that I think our audience would appreciate. So there's soft brushes, there's medium. How do you know which to choose? I use soft because my gums are sensitive. But
I don't like soft. Personally, I like hard because I like to know everything is clean and it feels cleaner to me.
mm-hmm.
I like an electric toothbrush because I think a machine is better than an old 100-year-old toothbrush. So that's the way I view it personally and for my patients.
How often should you change them?
Every 8 weeks or so. Take a walk to the drugstore and for a few bucks you can get a new brush.
I'm always rotating because I brush so much. So
That's okay. It'll never hurt you.
So let's talk about Fox Fresh Breath.
Right.
You've created this system. Please tell our audience about it. It's fascinating.
Well, bad breath is offensive. It affects you socially. It can affect you in the workplace. And it's a signal that something's wrong. So what's happening is that the anaerobic bacteria in your mouth are going to work on food and releasing something called volatile sulfur compounds. And that smell, like a body odor, gets in the way.
Mm-hmm.
So what we like to do is use instrumentation and medication and bring that count down so that you're able to function in society the way you should.
Because with your creation, now you're eliminating surgery. Because otherwise, people often need surgery when they're suffering from halitosis and periodontal disease.
It's
correct?
a non-surgical approach.
Yeah.
Sometimes you have to do that, but generally speaking, it's a non-surgical approach.
And so, Dr. Fox, so many people on television have these amazing, perfect, beautiful smiles. Are they all wearing veneers?
Well, I'm sure a lot of them are, but it doesn't always have to be amazing and perfect. Sometimes a little imperfection makes it look more natural.
Mm-hmm.
So we try and look at a patient's face. We try and shape it the right way, give them the right color, and it's a discussion that we have with the patient, so it's really set up for that individual.
Are there different types of veneers that people can do?
Yes, there's the conventional veneer where you're preparing teeth and taking about 1 millimeter off of each tooth so that there's enough room for the veneer. And then there are some people who can have a veneer, I call it a slip-on veneer, where you don't have to use the drill. It's really ideal, but that's for a 1 in 25 who are ideal candidates.
And the thing about veneers, I mean, that is a commitment for life because once you do it, there's no turning back, right?
No question about it. So you have to really make sure that's what you want to do, and you have to think about the fact that you don't get another set of teeth.
So for someone who's interested in pursuing the opportunity of getting veneers, how long does it take from start to finish? How many appointments? Typically,
Sure.
I know it's different for everyone.
It's usually about 2 visits. One to
Really?
prepare it, take the impressions, and then about a week later or 2 weeks later, you put the veneers in. You have discussions in between about how it looks and as far as the temporaries are concerned, so you get a better idea of where you want to go and design. But generally about 2 weeks. It's fast.
That's not bad.
No, it's fast orthodontia.
Perfect teeth in 2 visits.
No question.
Now, what about tooth whitening? So many people get their teeth whitened, and that's a lovely thing to do. I know I've done it a million times. I know you have your own procedure that you've invented. Can you tell us about that?
Yes. Well, we use a machine to whiten the teeth, and that takes about half an hour. And then we put a calcium coating on the teeth, which remineralizes the teeth, which comes out of the work that I did with all kinds of dental products to put that liquid calcium back into teeth to restore it. And then we'll give them trays sometimes to touch it up at home with a bleaching agent so that they can have it last for years. So it's a wonderful thing if you like the position of your teeth. It's nice to have bright teeth. People see the eyes and the teeth first when they look at somebody's face.
Yeah, definitely. Now, I know that you've developed a lot of different patents and you have a lot of patents pending, and you've taken the company public.
Yes.
So can you tell us about that? Because that's fascinating and it's amazing, and I think it's an entrepreneurial dream to take a company public.
It was fun.
Did you ever think when you were this little boy working in your dad's office, then aspiring to become this amazing world-renowned dentist, that you would take a company public?
No, my father told me to stay away from the stock market, but I licensed the technology in 1992 from the federal government and the American Dental Association to restore and repair and remineralize tooth structure. And we put it into the first toothpaste to do that with liquid calcium. And I believe that that changed oral care. We're looking back now 25 years later because it's in a myriad of different dental products. And that's transformed the lives of millions of people all around the world.
Because a long time ago there was fluoride in products,
correct?
And is that no longer exist?
No, fluoride is still there,
Yes.
but it works in conjunction with the fluoride to rebuild the enamel.
Wonderful. So your teeth essentially stay healthy a lot longer.
Correct.
And maybe less people are getting dentures.
Well, hopefully they're not getting, but
right?
dentures are really a thing of the past, hopefully.
Yes.
And implants are the present. So we really focus on implants. And you asked me about public companies.
Yeah.
So yes, I took it public in 1997. I was able to raise in excess of $70 million, and the product was in 42,000 stores. So it was a great ride, and I had a lot of fun.
That's amazing.
I enjoyed it. I had a Nobel Prize winner working for me, the Assistant Surgeon General of the United States, and the Dean of the Harvard School of Dental Medicine, where I served on the faculty at the time.
And you teach at a lot of different universities.
I did.
I
did.
And why don't you tell our audience about that?
Well, I taught at Harvard and NYU. I was on a technology review board at the University of Pennsylvania. So I like to keep my hands in the academic world.
So, Dr. Fox, tell us a little bit about these veneers and walk us through the experience.
Okay, so we typically inject a patient, and then we take a diamond burr and put it in a handpiece and strip the tooth a little bit, about 0.5 millimeter to 1 millimeter. And then in the laboratory, we have a porcelain veneer made, and that's bonded to the tooth with a special kind of cement, and it covers the tooth, and we can change the color and the shape and give somebody a new look.
It's amazing. It's incredible. How long would something like this take? I know you said it's 2 visits, but from when you come in for that second appointment, how long does it take to place if, say, you were doing a full mouth?
Well, it would take about 3 hours for the top to prepare it and 3 hours for the bottom to prepare it and making temporaries so that when you leave, you look normal. And then 2 weeks later, you come back, and again, it would probably be 3 or 4 hours to place them. So it takes a little bit of time, but it's done quickly. That's
very quickly 2 visits.
Right.
And I guess that's why you have this lovely TV, so people can...
You need a distraction in the dental office.
Yes. All right. Dr. Fox, the evolution of dentistry has been unbelievable in the 21st century, and you've been at the forefront of this. Where do you see this all going? What is your hope for the future?
Well, I think stomatology, diagnosis, where you look at the saliva or you look at the blood. It's called a liquid biopsy, and you can read the DNA or the RNA, the genetic code of a human being, and see if they're susceptible to disease like cancer or heart or diabetes or something of that nature. It's a window to the future. The mouth has been called the window to the rest of the body.
Yes, because like you said earlier, if something's not wrong in the mouth, it is a symptom that something is not wrong in the rest of the body, most likely.
Absolutely. So we can tell if there's systemic disease sometimes, if there's something that looks off, or sometimes it's isolated to the mouth. But we have a way of viewing the mouth after seeing patient after patient after patient and studying pathology, where if something doesn't look right, it's a red flag.
Yes. And I know there's so much research being done with Alzheimer's, and there's been so many links with the bacteria in the mouth leading to Alzheimer's and amongst other diseases like we've discussed. Where do you see that taking us? Wouldn't that be nice if we could capture that someone's already predisposed to Alzheimer's?
Well, that's premature right now,
Yeah.
dementia, but uh, there are certainly a lot of diseases that aren't premature. Strokes, diabetes. Bacteria can make diabetes worse, and diabetes can make bacteria worse. The inflammation. So it's the inflammation that causes the strokes and the heart attacks potentially, as well as up to 6 kinds of cancer. So there's all kinds of studies that are going on all over the world in reference to what's going on in the mouth.
Dr. Fox, you've had such an incredible career and you're still so young. What would you like your legacy to be?
Well, I hope that I've impacted oral care for a lot of people and made it better. Uh, on the mini level, I've done it in my own office, and on the macro level, I've done it with certain products that I invented. So I hope that it changes in a positive way oral care for a lot of people.
You've already done that, Dr. Fox.
Thank you.
Thank you. And thank you for watching.